Welcome to our essential guide on the early symptoms of cancer. Many cancers start with subtle symptoms that are easy to overlook. By learning about these early indicators, you can take proactive steps toward timely diagnosis and treatment. Cancer, a word that often evokes fear and uncertainty. It refers to a group of diseases characterized by the uncontrolled growth and spread of abnormal cells. As the second leading cause of death globally, cancer affects millions, yet survival rates are improving due to advancements in screening, treatment, and prevention. Today, we will explore some early signs and symptoms of cancer, encouraging you to be vigilant and proactive about your health. It's important to note that cancer symptoms can vary greatly depending on the affected area of the body. However, there are some general symptoms to be aware of. Let's begin by exploring some common early symptoms that are often shared across various types of cancer, starting with changes in skin appearance. Skin cancer often manifests through visible alterations. Look out for darkened, yellowish, or reddish patches on your skin. Pay attention to any sore that doesn't heal or a mole that changes in size, shape, or color. If you experience excessive itching, scaling, or bleeding, it's time to consult a healthcare professional. Next, let's discuss persistent cough or hoarseness. A cough lasting more than 3 weeks, particularly if accompanied by blood in the mucus, could indicate lung, throat, or thyroid cancer. If there's no improvement with medication, seek medical evaluation promptly. Unexplained weight loss. Have you noticed a sudden drop of 10 pounds or more without trying? This could be an early sign. Whether it's a loss or gain, unexplained fluctuations in weight could signal an underlying issue, including cancer. Next, persistent fatigue. If you're constantly feeling tired despite getting enough rest, this could be more than just a busy lifestyle. It may be time to consult a healthcare professional. Changes in bowel or bladder habits can also be a red flag. Persistent diarrhea, constipation, or changes in the frequency of urination warrant a medical checkup. Difficulty swallowing or hoarseness could signify cancers of the throat or esophagus. If these symptoms persist, seek medical advice. Experiencing persistent indigestion or discomfort after eating, these could be signs of stomach or digestive tract cancers. Muscle or joint pain without a clear cause, along with unexplained fevers or night sweats, might also be early warning signs. Unexplained bleeding without an apparent cause can be alarming and warrants immediate attention. Coughing up blood might be a sign of lung cancer. Blood in the stool may relate to colon or rectal cancer, while vaginal bleeding between periods or after menopause could suggest cervical or uterine cancer. Bloody urine may be linked to bladder or kidney cancer. If any of these symptoms persist for more than 2 weeks, it is crucial to seek medical advice for early diagnosis and treatment. Unexplained bleeding or bruising can be a symptom of various cancers, including leukemia. Lastly, unusual lumps or swelling. Pay attention to any lumps or abnormal swellings in areas such as the breasts, testicles, lymph nodes, or soft tissues. Remember, recognizing these early symptoms is crucial for timely intervention. If you or someone you know experiences any of these signs, don't hesitate to seek medical attention. Early detection saves lives. Understanding these symptoms is only part of the battle. Let's talk about what causes cancer and how you can lower your risk through prevention strategies. Let's begin with one of the most well-known culprits, smoking and tobacco use. Tobacco smoke contains over 7,000 chemicals, many of which are carcinogenic. Smoking is a leading cause of lung, throat, and oral cancers, while chewing tobacco increases the risk of mouth, throat, and pancreatic cancers. The message is clear. Eliminating tobacco from your life can significantly reduce your cancer risk. Next, we turn our attention to diet and nutrition. Consuming a diet high in processed foods, red meats, and refined sugars can lead to obesity, inflammation, and hormone imbalances, all of which are linked to increased cancer risk. On the flip side, a diet rich in antioxidants, fiber, and healthy fats can help protect against cancer. By making mindful food choices, you can take control of your health. Ultraviolet or UV radiation, often from excessive sun exposure or tanning beds, is a leading cause of skin cancers, including melanoma. It's essential to protect your skin with sunscreen and avoid prolonged exposure. Additionally, high doses of radiation, such as those from frequent X-rays or nuclear sources, also increase cancer risks. Next, we address genetic mutations and family history. Certain cancers like breast, ovarian, and colon cancer have significant genetic components. If you have a family history of these cancers, regular screenings and genetic testing can be crucial for early detection and prevention. Moving on to viral infections and chronic inflammation. Some viruses are known to increase cancer risk. The human papillomavirus, or HPV, is linked to cervical, anal, and throat cancers. Similarly, hepatitis B and C are associated with liver cancer, while Helicobacter pylori, a common stomach bacterium, increases the risk of stomach cancer. Vaccinations and regular checkups are vital preventive measures against these infections. Physical activity plays a crucial role in cancer prevention. Being overweight or obese is associated with a higher risk of several cancers, including breast, colorectal, and kidney cancers. Engaging in regular exercise helps regulate hormones and reduce inflammation, thereby lowering your cancer risk. Incorporating physical activity into your daily routine is an effective step towards a healthier future. Lastly, let's discuss alcohol consumption. Drinking alcohol in large quantities can increase the risk of liver, throat, esophageal, and breast cancers. Alcohol breaks down into acetaldehyde, a toxic substance that can damage DNA and promote cancer growth. Moderation is key. By limiting alcohol intake, you can decrease your risk. In summary, while genetic predispositions may play a role, many factors contributing to cancer are within our control. By making informed lifestyle choices, we can reduce our risk and lead healthier lives. Finally, let's talk about exposure to carcinogens. Prolonged exposure to industrial chemicals, asbestos, pesticides, and air pollution significantly raises cancer risk. It's important for individuals working in hazardous environments to take necessary precautions and minimize exposure wherever possible. By staying informed and engaging in preventive practices, you can contribute to your health and well-being. Cancer prevention strategies. While some risk factors like genetics are beyond our control, there are many lifestyle changes we can make to significantly reduce our risk of developing cancer. First and foremost, quit smoking and avoid tobacco. Steer clear of tobacco products and secondhand smoke, as this is the single most effective way to prevent lung and oral cancers. If you or someone you know is struggling to quit, seek support. It's a critical step towards a healthier future. Next, let's focus on diet. Maintaining a healthy diet is essential. Fill your plate with plenty of fruits, vegetables, whole grains, and lean proteins. Cut back on processed meats, fried foods, and sugary beverages. Opt for antioxidant-rich foods like berries, nuts, and green tea. Physical activity is another cornerstone of cancer prevention. Aim for at least 150 minutes of moderate exercise each week, whether it's walking, jogging, or swimming. Moderation is key when it comes to alcohol. Limiting your intake or avoiding it altogether can lower the risk of liver, breast, and esophageal cancers. Protecting your skin from UV rays is crucial. Use a sunscreen with an SPF of 30 or higher, wear protective clothing and sunglasses, and avoid tanning beds and excessive sun exposure. Vaccinations also play a vital role in cancer prevention. The HPV vaccine helps prevent cervical and throat cancers, while the hepatitis B vaccine reduces the risk of liver cancer. Regular screenings and early detection save lives. Make sure to schedule mammograms, pap smears, colonoscopies, and prostate exams as recommended based on your age and family history. In conclusion, taking these proactive steps can empower you to lead a healthier life and reduce your cancer risk. Finally, be mindful of carcinogen exposure. Limit your contact with radiation, industrial chemicals, and air pollution. Use protective gear in hazardous environments and improve air quality at home and work. When to see a doctor. It's essential to be proactive about your health, especially when it comes to cancer concerns. If you experience any persistent signs or symptoms, don't hesitate to make an appointment with your doctor. Early consultation can make a significant difference. Even if you're not experiencing symptoms but have concerns about your cancer risk, it's important to discuss these with your healthcare provider. They can guide you on which cancer screenings are appropriate for your situation, helping you stay one step ahead in your health journey. Remember, taking action today can lead to a healthier tomorrow. We hope this video has been informative and reassuring. If you found it helpful, please like and share it with others who might benefit. And don't forget to subscribe to our channel and hit the notification bell so you're always informed about our latest health tips and updates. Thank you for watching. Stay informed, stay healthy.